How to explain number of visits and visit durations for full arch implants. Setting clear visit expectations does more than schedule appointments. It helps patients feel calm and confident from day one. When you explain what will happen at each visit, you reduce anxiety and build trust, because patients know what to expect instead of imagining worst-case scenarios. Clear timelines also prevent misunderstandings about how long treatment will take or when results will appear, which avoids frustration later. Finally, when patients understand the plan and timeline, they're more likely to follow instructions and attend appointments, which improves satisfaction and adherence to the care plan. Honest, upfront communication pays off in cooperation and better outcomes. A full arch implant journey usually follows 3 main phases, each with a clear purpose. First, the initial consult and imaging. We take a medical history, perform a clinical exam, and capture scans or X-rays to diagnose and plan the implant positions. Second, the surgery visits. Implants are placed, sometimes with bone grafting, and you'll receive immediate post-op care instructions and prescriptions. Third, the restorative visits. These include impressions, try-ins, adjustments, and fitting the final prosthesis, so function and aesthetics are optimized. Patients benefit from understanding these phases, so they know how each visit contributes to the final result. Most straightforward full arch cases require about 3 to 6 visits from the initial consult through final delivery. A planning visit, 1 or 2 surgical appointments if needed, and several restorative visits for fittings and adjustments. Complex cases, those needing extensive bone grafting, staged surgeries, or medical clearance, may require additional staged appointments that extend the timeline. Always offer patients a clear minimum. For example, expect at least 4 visits and explain possible additions so they aren't surprised if extra steps become necessary. Framing a range helps patients plan their time and reduces frustration if the process expands. Visit length varies by phase and clinical needs. A consult typically takes 30 to 60 minutes to review medical history, examine the mouth, and discuss treatment options. Surgery can range from 1 to 4 hours depending on how many implants are placed and whether grafting or extractions are performed. Add recovery time and post-op instructions. Restorative visits, impressions, try-ins, and adjustments usually take 30 to 90 minutes each, depending on complexity and whether lab work or occlusal fine-tuning is needed. Giving patients these realistic time frames helps them arrange transportation, time off work, and support after surgery. Use simple, reassuring language that outlines next steps. For the consult, today we'll do a full assessment and plan the timeline. This sets the purpose and signals planning. For surgery, surgery may take X hours. Expect post-op instructions and recovery time. Replace X with the expected range and note any limitations after the appointment. For restorative care, you'll have several restorative visits for fittings and adjustments. Add estimated durations and why each visit matters. These phrases are direct, patient-friendly, and normalize the process while setting clear expectations about time and follow-up. Variability is normal in implant care. Explain common factors that can change the schedule, such as bone graft needs, individual healing times, and lab turnaround for prosthetics. Tell patients you'll monitor progress and that follow-up calls may be needed to reschedule or add visits if healing differs from the plan. Have a clear contingency plan ready. For example, an extra healing appointment after grafting, or an interim prosthesis if labs are delayed. Communicate contingencies up front so patients understand potential detours and feel reassured that you'll guide them through any changes. Make plans tangible. Use simple timelines, visual aids, or visit checklist so patients can see each step. Confirm understanding by asking the patient to repeat the plan back in their own words. This quickly reveals gaps or confusion. Always provide a written summary of the agreed timeline, key instructions, and your contact information for questions or concerns. Encourage patients to call with changes in pain, swelling, or healing. Early communication prevents complications and unnecessary delays. These small steps make your care feel organized, transparent, and supportive. When discussing full arch implant care, lead with a realistic visit count range and expected durations so patients can plan. Highlight potential sources of variability, like grafting, healing rates, and lab timing, and explain next steps if the plan changes. Use consistent phrasing, visual timelines, and written summaries to reinforce your message. Clear, honest communication reduces anxiety, improves adherence, and enhances patient confidence in the process. Ultimately, predictable expectations plus compassionate follow-up produce better experiences and clinical outcomes for both patients and the care team.